Hi, Dr. Adil. My friend has got breast cancer during pregnancy. What is the treatment plan given for breast cancer during pregnancy or breastfeeding?
So breast cancer in pregnancy, it's a challenging situation. So how common is breast cancer in pregnancy? So fortunately for us, breast cancer usually affects the elderly women, that is in the 50s and 60s, in the postmenopausal age group. So in pregnancy with breast cancer per se it is rare, but having said that, 1 in about 3,000 pregnancies to around 5,000 pregnancies may be affected with breast cancer. But we need to note, a patient who has a family history of breast cancer has a more likelihood of having breast cancer and pregnancy. So now, having known how common it is, let us see what is the presentation. So before we know what is the abnormal presentation, we know what are the normal changes which happen during the breast during the pregnancy. So the normal changes include increase in the size of the breast, the increase in size of the nipple, the areolar complex, and there may be some whitish discharge coming from the nipple. So these are all normal changes which happens during a normal pregnancy in anticipation for the baby. So what are the changes that are abnormal? First, it is a painless lump. A painless lump which is lasting for more than 2 weeks should alarm you for the possibility of a breast cancer. That is number 1. Number 2, a bloody discharge from the nipple. And number 3, suppose if there are skin changes, skin redness. So all these things should prompt you to go to a doctor for a diagnosis of breast cancer. So when you are suspecting breast cancer in pregnancy, so what are the modalities of investigation and how to go about it? That is the second question. So the modalities of investigation include, first is a physical examination, that is the most important. Second is an imaging. Third is a needle testing. So once the doctor examines you and thinks there is a doubt for breast cancer, the second thing what they do is they ask for imaging. So in pregnancy, there are certain types of imaging that can be done, certain types of imaging that needs to be avoided. So in general, an ultrasound is safe, very safe. In fact, it is the primary modality of choice to investigate a suspicious breast cancer lesion. Second, even a mammography can be done with abdominal shielding. That is number 2. And if there is still doubt, an MRI can be done. So ultrasound, a mammography and MRI can be done during pregnancy. So what are the imaging to be avoided? One is a PET CT and one is a bone scan. So once you suspect a breast cancer, we have to confirm by tissue diagnosis the diagnosis of a breast cancer so that we can go for the treatment. So to confirm the diagnosis, we do a needle testing. Make note that the needle testing is perfectly safe in breast cancer. So let us assume now you have a lump, it is suspected to be a breast cancer, you did a needle testing and breast cancer is confirmed. What next to do? So there are different modalities of treatment. As in any cancer, there is surgery, there is chemotherapy and there is radiotherapy. Unfortunately, radiotherapy, although it plays a very integral role in breast cancer, the role in pregnancy is a little controversial. Why? Because of the harm that may potentially come to the fetus. So we are left with 2 things. One is surgery, second is chemotherapy. So out of the surgery and chemotherapy, again it depends on how advanced is the stage. So we can divide the cancer into 2 parts. One is an early stage and one is an advanced stage. So suppose if the patient is having a very early stage, then surgery can still be contemplated in the 2nd and 3rd trimester of pregnancy. So what do you mean by trimester of pregnancy? First trimester means up to 12 weeks. The 2nd trimester means from up 13 weeks to approximately 26 weeks. The 3rd trimester is from 27 weeks onwards. So because the main organogenesis or the organ development of the fetus is happening in the 1st trimester, the treatment modalities in the 1st trimester we generally avoid, especially the chemotherapy and surgery, because of the harm that may potentially come to the fetus. But these therapies can be safely given in the 2nd and 3rd trimester. So even among the chemotherapies, not all therapies can be given. There is something called hormonal therapy and targeted therapy which are best avoided during pregnancy. So long story short, if the patient is having an advanced disease, chemotherapies are safe in 2nd and 3rd trimester. Surgery is safe in 2nd and 3rd trimester, but radiotherapy has to be avoided. This is how the treatment modalities go for pregnancy. And also, to bring into a nutshell, there has to be good cooperation between the different departments. That is your obstetrician, your neonatologist, your medical oncologist, your radiation oncologist, your psychiatrist. Everybody have to collaborate so that a successful treatment of breast cancer takes place.